Okay, I have all of my material and I'm ready to go. I'm gonna go get my patient. Hello, Mr. Webb, how are you?
I'm great, how are you?
Can you turn around
Yes,
for me?
yes I can.
Okay, I'm just gonna get you to lift up your leg, and then the other leg, and then bend your knee, rotate your ankle, other knee, rotate your ankle. Okay, good job. You can go sit down for me. Can I get your full name and date of birth?
Cody Daniel Webb, September 22nd, 1995.
Do you have any allergies?
Penicillin.
Okay.
Yeah.
I have gathered all my supplies. I have performed hand hygiene, and I have provided privacy. Okay, so, do you know where you're at today?
Yes, I'm at the hospital.
Okay, and what day is it?
March 1st.
And why are you here?
Full body assessment.
Okay, good job. I'm just going to start off by getting your vital signs. We're going to do a head-to-toe assessment on you. If at any point you feel uncomfortable or you're in pain or you have a question, just ask me. And then, yeah, that'll be it. So, I'm going to first start off by assessing his vital signs. Blood pressure, normal is going to be 120 to 80, or 120 over 80. I'm going to assess respirations. Normal is 12 to 20. I'm also going to assess your pulse, which normal is 60 to 100. I'm going to assess temperature. Normal is 98.8. And I'm going to assess your pulse ox. Normal is 95% to 100%. Are you in any pain today?
No, I'm not.
Okay. If the patient was in any pain, I would ask him to rate it on a scale of 1 to 10, and then I would also evaluate it on the Colder method, which is character, onset, location, duration, exacerbation, radiation, and relief, anything that provides the pain some relief. Okay. Now, I'm just going to get you to do your arms for me. Up, beside your ear. Other side, up beside your ear. And bend your elbows towards the sky. And then rotate your wrists. Okay, good job. Range of motion in the upper and lower extremities is good. Now I'm going to start off with your eyes. Eyes are symmetrical. Looking at them, there's no excessive redness or exudate around the eyelashes. They look clear. This light might be a little bit uncomfortable for a minute. Just look at my nose. Okay. Pupils are equal, round, and reactive to light. Look at my finger, follow it to your nose. And accommodative. Now I'm going to assess cranial nerves 3, 4, and 6. 3 is the oculomotor, 4 is the trochlear, and 6 is the abducens. This is extraocular eye movements. Look at my pen and just follow it with your eyes without moving your head. Okay, all of those cranial nerves are intact. Now I'm going to look at your nose. Just look up for me. Okay, the nares look free and clear of any exudate. Can you hold one side down for me and breathe out the other side? Now the other side. Okay. Nares are patent. Nose is symmetrical and seems appropriate for the face. Now I'm going to move on to the mouth. Can you open and say ah?
Ah.
Stick out your tongue. Okay. That was cranial nerve number 9, which is the glossopharyngeal. You keep opening for me. I look inside. All the teeth are intact. The palate elevates evenly and nicely. The oral mucosa is pink and moist, along with the tongue. The lips are pink and dry, but not too dry. The mouth is clean. There are no lumps, lesions, open wounds, anything like that. The ears are symmetrical, free of any kind of exudate. No lumps or lesions there. The patient is alert and oriented ×4, person, place, time, situation, and is obviously awake. Okay, now I'm going to go ahead and go down to your neck. Does that hurt?
No.
Okay. I'm going to palpate the carotid arteries one at a time. You don't have to lean back. It's okay. Okay. Those are equal bilaterally +2. I would also assess for jugular vein distension. My patient would be at a 45-degree angle, and I would be looking for any kind of distension in the neck right here, which there is none. Next, I'm going to listen to the carotid arteries. I would be looking for any bruit, which is abnormal. I just want to hear a nice, clear sound through the carotid. Okay, those sound good. Next, I'm going to assess your arms. Okay, is there any pain? All right. The skin is warm and dry and pink. No lumps, lesions, bumps, anything like that. I'm assessing capillary refill in each finger, which is less than 2 seconds. No clubbing of the fingers, which is also a good sign. Any pain? Okay. Now, skin is also warm, dry, and pink. Also assessing capillary refill in each finger. Less than 2 seconds, which is good. Also, no clubbing of the fingers. Can you feel my touch?
Yes.
Okay. Now, will you grab onto my 2 fingers? Squeeze. Okay, that's good. The sensation and strength is equal in both sides and good. Okay. Can I get you, did I already do your arms? Okay. Now I'm just going to listen to your lungs. I'm going to listen to each lobe on each side. Every time this moves, will you just take a deep breath for me?
Yes.
Okay, now the sides. All right, now you can move back to the front. Again on the front side. Lung sounds are clear, equal bilaterally. No presence of wheezing, crackles, rales, rhonchi, anything like that. They're all clear. Okay, now I am going to assess your heart. Okay. Okay. I'm first going to start with the aortic valve. I'm going to listen both with the bell and the diaphragm. This is the aortic valve. S2 is louder than S1. This is the second intercostal space on the right side. I'd move over to the left side. This is the second intercostal space. This is the pulmonic valve. And S2 is also louder than S1. Now I'm going on to Erb's point. S1 and S2 are equal. This is the third intercostal space on the left side. Now on to the tricuspid valve. Fourth intercostal space on the left side. S1 is louder than S2. And now I'm going down to the apex, which is the tricuspid valve, in the fifth intercostal space of the midclavicular line. This is also the PMI, point of maximum impulse. I would listen here for 1 minute. Okay? Sounds are normal, rate and rhythm is normal, no increased effort of breathing. The sounds are normal, just the regular lub-dub is what I hear. Did I do the shoulders? Okay, I'm going to assess for cranial nerve 11, which is the accessory nerve. I'm going to place my hands here on your shoulders. If you could just shrug them against my resistance. Okay, now I'm going to place one hand. If you can just turn against resistance. Okay. That nerve is intact. Okay. Now I'm going to get you to lay down. The stomach is, the stomach has a normal contour. It is soft, not rigid. I'm not pressing on it right now. I'm just feeling it. I'm going to listen first. I'm going to listen to the vowel sounds for 1 minute in each quadrant. I'm looking for normal sounds of 5 to 30 per minute, and anything less than 5 is hypoactive, which means I would go back and listen in each quadrant for 2 minutes each. Yeah, that's okay. I would listen in each quadrant for 1 minute. Very active. You just ate dinner. Okay. Those are normal sounds, maybe even hyperactive. The stomach, like I said, is normal. I'm going to palpate now. Tell me if there's any tenderness or if there's any pain. Okay. The stomach is soft and not tender, not rigid. No pain in the stomach. Seems to be very normal. Okay, now I'm going to get you to sit up. Well, actually, I could have assessed your feet that way. Okay, I'm going to, when was your last bowel movement?
A couple hours ago. Soon.
And, are you experiencing any problems with urination?
Oh no.
Okay. Okay, can I get you to sit up straight for me? I'm going to place my hands on top of your legs if you can move against resistance. Both sides, both at the same time. And move it out against resistance and move in. Okay. Can you feel this?
Just can't.
Okay. Sensation and strength is equal in both sides bilaterally. And I would also look for the femoral pulse, which is on the inside of the upper thigh. I'm also going to inspect the feet for clubbing of the toes and a capillary refill of hopefully less than 2 seconds in each toe on each side. And I'm also going to look for the pedal pulse, which is on top of the foot. And I'm also going to look at the posterior tibial pulse, which is in the back of the ankle, right above the heel. I would also perform a Braden scale on the patient. And make sure my patient is comfortable. I would assess the strength in the feet as well. I will put my patient in locked and low position, make sure he's comfortable, document, and wash my hands, and I'm done.
Coronavirus.